Stigma and society's view on drug-dependent individuals. An introduction. Thank you for joining us today on the Caffrey Class Network. I'm your host, Jacqueline, and today we will be discussing stigma in illicit drug use. Substance use disorder affects roughly 19 million Americans each year, yet the public perception has not changed over the years until recently. Utilization of drug treatment programs by methamphetamine users. The Role of Social Stigma by Shirley J. Semple, Igor Grant, and Thomas L. Patterson. In a study conducted by Dr. Shirley Semple and her colleagues, it was found that out of 292 people who reported using meth, an overwhelming number of respondents agreed that there are negative social stigmas attached to regular meth use. Their data confirms that meth users understand how society treats them. Additional research is needed to further understand how society and government plays a role in patients seeking care, with a possible correlation between healthcare workers acting in inconsistent ways with the Hippocratic Oath and substance use disorder patients facing discrimination. What is stigma? Stigma is when someone views you in a negative way because you have distinguishing characteristics or personal trait that's thought to be or is actually a disadvantage. Why is there stigma? Illicit drug use disorder is one of the most stigmatized health conditions. The degree of stigma is related to the perceived cause of the condition. If perceived not to be the person's fault, stigma is lower. Types of stigma faced. There are many different types of stigma that contributes to an individual's sense of self and how society perceives and interacts with them. In addition to how society views the individual, the person can also be at odds with their self. This can negatively affect the way they behave and interact or don't interact with the rest of society. Drug use in the media. The media has a big influence on how people perceive things. An article on how a man or woman, under the influence of drugs that caused a car accident, paints a picture that all drug users are bad or dangerous. In an article about a man or woman's struggle with cocaine addiction and their path to being clean, it might be praised or seen as inspirational. The media plays such a large role in our everyday lives that it's taken very seriously. Some people accept something they read in a news article or a news report on the television as nothing but the truth. This further adds to the stigma that all drug users are bad, when that might not be the case at all. Some examples. Shows such as Shameless portray the drug user as a deadbeat. In this show, the parents Frank and Monica Gallagher are portrayed as flaky, deadbeat parents who weren't there for their family. In the show Euphoria, the plot focuses more on the mental struggles with drug use. It focuses on drug use among teenagers and the hardships they go through while they attempt to get help. Shows and movies such as That 70s Show and Dazed and Confused show heavy use of marijuana. The popular show House portrays drug use, but in a seemingly helpful way. Ways our society stigmatizes. The way our system is set up often promotes a lack of empathy across society, particularly with victim-blaming tactics. Society views illicit drug users in a negative light, which hurts the odds of recovery for them. Practically all parts of society take part in shunning these individuals by creating legislation to bar them from getting a job or receiving aid, for example. Additionally, it may contribute to higher incarceration rates. Someone who is a drug user may not be getting the care in prison and mechanisms needed to cope without the drugs, therefore continuing the cycle where they are in and out of the system. Anti-drug policies, dubbed the War on Drugs, created under the Nixon administration, also contributed to the public's fears and increased incarceration rates, especially among the Black community. How can we help illicit drug users? There are a variety of ways to help. Here are some ideas: behavioral counseling, medication, medical devices and applications used to treat withdrawal symptoms or deliver skills training, evaluation and treatment for co-occurring mental health issues such as depression and anxiety, long-term follow-up to prevent relapse, and rehab. What can be done? Public health needs must be addressed. Easily accessible services with non-discriminatory practitioners willing to help an individual regardless of age, sex, ethnicity, or income. Additionally, legislation must be passed to protect those vulnerable individuals by offering amenities such as job security, temporary assistance upon receiving proof that the individual is receiving care, and passing stricter anti-discriminatory laws to help them. Regardless of the public's view on drug-dependent people, having shelter, healthcare, and being treated with respect should be our priority for the health of this nation. Human rights should be at the forefront of every conversation we are having, especially when it involves people who are alienated due to society's bias.